It's just another tool in the toolbox for treating prostate cancer that will allow some guys to avoid all of those side effects, which, I mean, there are people in my profession, urology, who just treat the side effects of prostate cancer. That's their only role, is treating incontinence and erectile dysfunction. So if we can eliminate some of that in a few men, that's going to make a better quality of life, and it gives us something else to try to treat these guys and not give them devastating side effects. This is just a very modified ultrasound. So we have used ultrasound probes in the rectum for diagnosing and managing prostate cancer for decades. This is just a fancy modified ultrasound that sends these ultrasonic waves, these highly intense ultrasonic waves. It passes the healthy tissue and focuses on the areas that we have kind of marked for it to treat. And by heating up those ultrasonic waves hit there and heat up the tissue and cause necrosis. So it kind of kills that area where we want. And it's very specific, so it has a very clean margin of where it's going to kill. It's not going to kill healthy tissue as long as we avoid it when we do the treatment planning. The Focal One approach is a robotic system, so it manually kind of shifts and changes as the prostate heats up. It's going to swell, and the robot automatically kind of conforms to that and makes sure we're not hitting the rectum or the urethra or any of that good healthy tissue that we're trying to avoid. It's outpatient surgery, so they'll come in, have the procedure done after some time, and it's usually a 1 to 3 hour procedure depending on how much gland we're going to ablate, and I would say that would favor the 1 to 1.5 hour range, and then of course a 30 to 45 minute recovery period, and then they go home. They will go home with a catheter, urinary catheter drainage bag, which is irritating, but it's, like I said, it's a true procedure, and we have to be safe and make sure we don't cause any other harms. Our goal is to use it only for focal therapy. Occasional hemigland, where you can still preserve one whole side of the gland and the tissue around it. So it's 100% about eliminating those severe side effects from other treatment modalities. Still knowing that you can treat with surgery and radiation if you need to down the road before this becomes a metastatic process.